Have you been stretching your shoulder, trying to strengthen it, trying to figure out what is going on? Maybe you just quit avoiding doing certain movements because it just hurts? Well, I'd like to invite you to think about this differently, because many times the pain that you have in the shoulder, and you feel it right in the joint, actually isn't coming from the joint. It's not actually the problem, the root of the problem. What if the way your shoulder blade has stopped moving is the actual issue? Because sometimes the place that hurts isn't where the story actually begins. It is in the foundation of it. So in today's video, let's explore why chronic shoulder pain is often connected to the way your shoulder blade moves across your rib cage, and how posture and the nervous system really influence that movement and what you can do about it. Let's explore some things that help restore the natural rhythm that you can bring back to a shoulder functioning normally. My hope is by the end of the video, you'll stop thinking of your shoulder as just this isolated joint right here and start to see it as part of a beautifully connected system. I'm Dr. Melanie Carlone. I'm a physical therapist, somatic practitioner, and someone who really believes our bodies are always adapting to the lives we live. They're always just trying to help us. And one of the things I love about movement is it reminds us that nothing in the body works alone. When you tune in, you start to see how everything's connected. When you reach for a cup, your rib moves, your spine rotates, your shoulder blade has to glide, your arm follows, and it feels effortless because hundreds of little micro movements are all working together. But pain often appears when one of those conversations in that whole symphony gets quieter and it's not working quite right. Now, the shoulder is especially generous, and it'll compensate for a really long time before it starts asking for help. When people start to think about shoulder pain because it's hurting, they often think about the joint itself, the rotator cuff. Maybe it's arthritis, maybe I'm getting tendonitis, or maybe I have a tear. And sometimes, of course, that's exactly where the problem is. But the shoulder joint doesn't move in isolation by itself. It rides on a platform, and that platform is your shoulder blade. So let's have a look here for a moment. Your shoulder blade is this triangular bone that rolls on your rib cage, and the shoulder joint itself is this humerus that sits inside of this cup, made up of your collarbone in the front, your scapula, your shoulder blade in the back, and this hollow space where the head of the humerus, the arm bone, sits. So when you move your arm, it rotates in this whole complex. But every time that you lift your arm, your shoulder blade should glide smoothly around the rib cage. It's this whole partnership. And if you go to lift your arm and that shoulder blade is not gliding down and in, then the shoulder has to work much harder than it's designed to. So once that shoulder blade starts getting sticky, you want to figure out pretty quickly what's going on. So what causes that shoulder blade to stop moving so well? Well, think about how many hours you spend all in the forward world. You're reaching forward, you're typing, you're driving, you're looking at your phone, you're working at a kitchen counter. Our whole world is like happening in front of us. And over time, the ribs get rounded forward, they become a little less mobile, your upper back rounds, the chest tends to curve inward, and those shoulder blades slowly stop gliding. Not overnight, but little by little. And so the nervous system adapts to it. It's trying to make those positions easier, and eventually that adaptation becomes normal posture. So if you had someone look at you from the side, what you want to see is the ear over the shoulder over the hip. But what happens over time with a lot of the forward work that we do in the world is the shoulder joint moves forward, the blade glides away from the spine, and you lose freedom. And the shoulder joint itself has to start making up the difference, which makes me wonder if posture changes movement, what's teaching that posture in your life? Well, one of the things I find most fascinating about the nervous system is it doesn't organize the body around perfect posture. Even though we're always being pulled on by gravity, it organizes around what's familiar. What are you doing all the time? What are you repeating? Because that's what your body gets efficient at. So if you've spent years tense and your shoulders slightly lifted, or your chest kind of collapsed inward, or your upper back's kind of still, those positions just become who you are, right? They become normal to you. Your muscles anticipate that that's what's going to happen. Every time you go to move, your fascia's remodeled itself around that position. Even your breathing changes. That's why saying sit up straight and pull your shoulders back usually doesn't last. The body will return back to what it knows, feels familiar, and it's adapted to. So instead of forcing a different position, what if you give the shoulder blade a sense, a felt sense, permission to start to glide again? So before we move on, tune into who you are and how you stand, because over time it just feels normal to be a certain way. So get in front of a mirror sometime today, or have someone take a picture of you from the side when you're not paying attention and just notice. Where are your shoulders? Are they under your ears and above your hips in a straight line? Are they rounded forward? Just notice, does one sit lower than the other? Usually your dominant hand, like if you're right-handed, does sit a little lower than the other. That's normal. Does one of your shoulder blades wing away from your ribs? Do you sense one shoulder's always kind of working harder? So leave a comment and let me notice if you notice something interesting, because our awareness of it is often where change begins. So this approach isn't a workout. It's a listening conversation into the nervous system. So give yourself permission here and move slowly. Stop anytime something doesn't feel right, but let's go slowly. We're going to take about 3 or 4 minutes and just explore the shoulder's position. So let's slowly take a breath in, breathing from the low back to the front, up into the chest, and let it go slowly. And again, low back ribs, front, chest, soft, slow, letting go. Now, we're going to do what I call scapular squares. And I want you to imagine if you had a pencil attached onto the shoulder straight out and a piece of paper here on the side. We're going to trace a square in the air using our shoulder blades, okay, right beside you. So go ahead and lift your shoulders slowly. And now slide them backwards evenly. It helps sometimes to look in a mirror. Now keep them back and lower them behind you, as down as far as you can. Notice a lot of times you get crunching and funny sounds here because you're not used to doing it. Keep them down low, slide them forward, and then back up, and then back to where you started. And you will have made a square, right? Now let's try it again, and we're going to go the other way. This time, lower the shoulders down, move them forward, forward and up and back. Keep breathing in the low back ribs. Keep it slow, back and down, and then to the center again. You're teaching the shoulder blades how to move in unison and telling it has more than one job, one possibility. Okay? So just notice, let everything go and feel. How does that feel? Okay, one more time. Up to your ears, back, back and down, forward, forward and up, back to your ears, and let go. Again, pushing down, forward, up, back, down and back, to the center, and relax. So now you've moved the shoulder blades all around the rib cage, freeing up motion within the shoulder joint. Now let's try something called scapular rolls. Let both shoulder blades just make slow, easy circles. Imagine them sliding over your ribs like two smooth stones across water. It's not big movement. It's about fluid movement. Notice if one side moves more freely than the other. Give it a moment to check it out. Do one shoulder up and around, and then the other one. Now you get your upper ribs moving. You don't need to fix it. You just need to notice those shoulder blades gliding and moving as you round them across the rib cage. Pause and now go the other way. One shoulder at a time. Again, not needing to fix it or change it. Just notice. Very powerful way for the shoulder blades to start to get some attention and time in motion. Now maybe you notice that right between your back shoulder blades there's a real tense area, or maybe up by the neck. This is where something like a firm ball, I like these lacrosse balls, but you can also use a tennis ball. Some people even use smaller, like, what were those bouncy balls when we were younger? They're really small but powerful. If you're a smaller person, the small, firm rubber balls can make a big difference. I want you to go against a wall, lean back, and place the tennis ball between you and the wall. So you just lean forward, catch the tennis ball with your shoulder, and lean back against it. And then lean into it. Take a slow breath and move a few inches in different directions. And when you find a spot that feels dense or guarded or tender, pause. You don't need to crank on these spots. These are often trigger points and they deserve your conscious tenderness. Tightness isn't a problem to force through. It's a protector. It's doing its job. And when you press on the protector, you can make a really big difference by getting into it, pausing without doing very, very intense motion, and then move your arm around almost like you're saying hello, like you're defining that protector. And then let it go, let it soft again, and then move again. It's not like you're pushing through it. You just meet the protector on the ball where the tissue can feel itself. Find a spot, move to another one, move your arm around on that ball, breathe into the low back, front, up into the ribs, let the breath go. Move it over to the other side, lean back, find that spot. And again, moving your arm, different positions. When you find a spot that's tender, don't push hard, just move the arm around to define the tense area in the muscles. Give about a minute to each side. And then slowly let your arm come overhead and feel the scapula gliding on your rib cage. Notice what's different. Notice if your breath is a little different, a little deeper, a little easier than the one before it. It's not something that you have to manufacture. It's like letting your body know that those protectors are seen and it can feel safe enough to let go. These balls can make a very big difference in removing some of the tense spots by letting your awareness come into them and restore movement into the shoulder blade. Because over time, when your shoulders start to become quieter, less motion, and you start to bring back intention and conversation into the area, everything starts to participate again. Your ribs start to move. The upper back starts to join the movement. Your neck is freed up. Now that shoulder blade glides. And when it glides, the joint itself doesn't have to force itself. It can move within the joint with greater intelligence. So when you get everyone in the shoulder complex to share the work, no one part has to work overtime or get overloaded. And things that can happen down the road, like tears, or even if you've had a tear, or even surgery. If you've been living with chronic shoulder pain, you can make a big difference by getting all the pieces and parts to release their chronically held tension, start to glide the fascia, and move again. So I hope that conversation can bring a little bit of a different perspective. Sometimes the answer isn't more stretching or more strengthening. It's about actually helping different parts of the body that have been sequestered, that have been quiet from moving together, how to move as a unit. Your body's incredibly generous. And when you restore cooperation within them, pain often, which is trying to get your attention, finally quiets. So if you've tried these movement ideas, I'd love to know what you noticed. Did reaching overhead feel easier? Did your shoulder blade move differently? Did you get a lot of crunching at first and then it went away? Or did something else surprise you? Leave a comment and let me know. And if this helped you see your shoulder in a new way, like this video, subscribe, and remember, move with kindness and compassion for yourself. Come on back and keep checking in, because I'm really dedicated to finding ways that we can bring awareness and intention into a healthier body. Because remember, sometimes the place that hurt is just the hardest working member of the team. So give the rest of your body, the rest of the team, a chance to help. Thank you, guys. See you again.